What is the connection between urinary retention and overflow incontinence? Imagine feeling like your bladder is a balloon that just keeps filling up but never empties completely. That's essentially what happens with urinary retention. It occurs when the bladder cannot fully empty, leading to a buildup of urine inside. Now, if the bladder becomes overly full and cannot empty properly, pressure builds up inside it. This increased pressure can cause urine to leak out involuntarily, which is known as overflow incontinence. So, in simple terms, overflow incontinence is often a direct result of urinary retention. The link between these two conditions is quite straightforward. Urinary retention is the underlying problem, and overflow incontinence is the body's way of responding to that problem. When the bladder can't empty as it should, it becomes overfilled. The excess urine then leaks out gradually or suddenly, causing incontinence. This leakage is often small amounts of urine dribbling out without warning, especially when the bladder is very full. There are several causes behind urinary retention that can lead to overflow incontinence. One common cause is an obstruction that blocks urine flow. In men, this is frequently caused by an enlarged prostate or prostate cancer that narrows or blocks the urethra. Other causes include bladder stones, strictures in the urethra, or even severe constipation pressing on the bladder. When the flow is blocked, the bladder continues to fill beyond its normal capacity, and eventually urine leaks out involuntarily. Another cause involves the muscles of the bladder itself. The detrusor muscle is responsible for contracting to push urine out. If this muscle is weak or doesn't work properly, due to nerve damage from conditions like diabetes, multiple sclerosis, or spinal cord injuries, the bladder can't empty fully. This results in urine remaining inside, leading to retention and eventual overflow leakage. Nerve problems also play a significant role. Conditions that damage the nerves controlling the bladder, such as spinal cord injuries or certain surgeries, can impair sensation or muscle function. For example, Fowler syndrome affects young women by preventing the sphincter muscles from relaxing, causing retention and overflow incontinence. Symptoms of these conditions often overlap. People may notice frequent urges to urinate but only small amounts come out. They might experience constant dribbling or leakage of urine without warning. Some feel like they haven't fully emptied their bladder even after urinating. In severe cases, they may be unable to urinate at all despite a full bladder. To diagnose these issues, healthcare providers usually start with a detailed history and physical exam. They may perform a prostate exam in men or a pelvic exam in women. Tests like ultrasound can measure how much urine remains in the bladder after voiding. Urodynamic studies evaluate how well the bladder muscles work, and cystoscopy allows direct inspection of the urinary tract for blockages or abnormalities. Understanding this connection is especially important when considering bladder health and conditions like bladder cancer. For instance, prostate cancer or its treatments can cause obstruction or nerve damage, leading to urinary retention and overflow incontinence. Chronic retention can also increase the risk of urinary tract infections, bladder damage, or kidney problems. Managing these conditions early helps prevent complications and maintain overall bladder health. In summary, urinary retention and overflow incontinence are closely linked. When the bladder cannot empty properly, urine builds up and eventually leaks out involuntarily. This process is often caused by blockages, muscle weakness, or nerve damage. Recognizing these signs and seeking medical advice can help manage the condition effectively and protect your bladder health. Always consult a healthcare professional for personalized diagnosis and treatment options to ensure the best care for your urinary health.